It is a deadly disease.
What is the progress of your work so far?
Young people have a key role to play in society. The Timor Island itself was rabies free until 2023.
Back again with another episode, and in this specific episode, we have Rebeca Sabou, who's going to talk about the rabies outbreak in Timor-Leste. And please tell me more about yourself.
Well, first of all, thank you for having me on your podcast.
Thank you very much.
As you mentioned, I'm involved in the rabies outbreak in Timor-Leste as the public health, risk communication, and community engagement specialist, supporting the Ministry of Agriculture, Livestock, Fisheries, and Forestry here.
Mm-hmm. And can you start explaining what rabies is?
So, rabies is a fatal but preventable viral zoonotic disease which affects the central nervous system of both humans and animals.
Mm-hmm.
And it is transmitted through the saliva of an infected animal, mainly through bites, but it can also be transmitted through scratches or even contact with the open wounds.
Mm-hmm.
Worldwide, dogs are responsible for over 95% of human rabies cases, and uh, this brings a lot of challenges because they're usually companions to the humans,
Mm-hmm.
but also other mammals can get infected, such as cats or goats, monkeys, because I've seen lots of monkeys here in Timor-Leste. And the challenge that exists worldwide is that once the symptoms of rabies develop or appear, it is a deadly disease for both humans and animals, which is why prevention is key in a rabies outbreak.
Okay, well, with that case, how can these rabies be prevented?
Um, it is very important to educate the population on how to prevent rabies. And on one side, it is preventable through vaccinating healthy animals um, and at-risk animals to make sure that they don't get the rabies disease in the first place.
Mm-hmm.
And statistically, achieving a minimum 70% vaccination rate would help control a rabies outbreak.
Mm-hmm.
On the other hand, it is important if looking at on the human side, if you get bitten by a rabid animal, mostly dogs, to make sure um, you get the post-exposure prophylaxis, which is wound management and the vaccination against rabies,
Mm-hmm.
and very much focus on at the community level is making sure you um, report the dog that caused the bite, but also to report dogs that show abnormal behaviors to the animal health clinics in the nearest area. Um, Currently, Timor-Leste is facing a rabies outbreak, and the most affected areas are Bobonaro, Covalima, and Okusi municipalities.
Oh, wow, that's very interesting because I've never heard that. And people in Timor-Leste are not used to reporting dog bites. It was not an uncommon thing to happen. And why is it important now?
It's a very good question, and I feel for the people, and I want to acknowledge the situation that they're going through, because many people may feel that it is unnecessary or strange to suddenly have to report dog bites and seek medical treatment after a bite, because this was not a concern before 2024.
Mm-hmm.
However, the reality is that rabies is present in Timor-Leste, and it is a deadly disease for both humans and animals.
Mm-hmm.
And this is why it is critical for everyone to try and adapt to the new reality and take dog bites seriously, and also seek urgent medical treatment in case they get bitten.
Okay, I see. So, with that case, what is the current situation of rabies outbreak in Timor-Leste?
So, as mentioned, related to the previous question, because this was not a common thing happening in Timor. I just want to maybe walk you through the timeline on how the disease entered the island. So the Timor Island itself was rabies-free until 2023, and the first dog-mediated cases and human deaths actually happen in West Timor, in Indonesia, with the first cases being reported in May 2023. And after that, the disease spread across the border in Timor-Leste, in the bordering municipalities of Bobonaro, Covalima, and Okusi. And unfortunately, it continues to spread further east, putting other municipalities such as Likisa, Meira, Ainaro, Aileu, and also Díli at risk. And this is because dogs move freely in Timor-Leste, and unvaccinated or infected dogs travel between villages and municipalities, and they carry the virus with them.
Wow, that's very crazy to think about. And can you share some data numbers of the overview with us?
So, looking at some numbers, the situation in Timor-Leste as of January 2025, so this year, we've seen over 1,000 recorded dog bites cases, and around 700 people who received post-exposure prophylaxis treatment, so wound management and vaccination. And there are over 70 confirmed rabies cases in dogs and 2 confirmed rabies cases in goats. And officially recorded 1 human death in Okusi.
1 human death in Okusi.
Yeah.
Wow. Can you describe the first case of rabies in humans in Timor-Leste?
Sure. I think this is also will give a good overview of what the disease actually is and the symptoms and how it develops. So, the first case was a 19-year-old female from Pasabe subregion, Okusi, and it was reported that she was bitten by a dog on December 26, 2023, on her hands. And prior to the bite, the dog showed aggressive behavior, and after she bit the patient, the dog died the next day. And it was unfortunate that the 19-year-old female didn't seek post-exposure prophylaxis like wound management and vaccination. And this led to her developing symptoms later in the next year on March 20th, 2024, where she presented to the local clinic with symptoms of flu-like symptoms, fever, pain in her throat, coughing, vomiting, and also she had difficulties swallowing food, and she developed a fear of light, a fear of water. And on March 21st, 2024, which was a day later, she was transferred to the National Hospital in Díli, where unfortunately she died the next day. And this example just shows that once the clinical symptoms appear, rabies is always fatal. And in the case of the patient from Okusi, it took about 3 months from when she was bitten by a dog, didn't seek treatment, developed the symptoms, and once she developed the symptoms, she died within 3 days.
Wow, so that's how serious the rabies is.
That's how serious this disease is. And it is unfortunately a very painful death for the patient and also for the family to see what a loved one is going through. So it's prevention is very important.
What are the signs of rabies in humans and animals, and how can you identify them?
So I'm going to start with the signs in animals because they're the ones carrying the disease and transmitting the disease. So in animals, the incubation period for rabies, and when I say incubation period, I mean the time between when an animal is bitten and is infected and starts showing the symptoms for rabies, varies between 10 days to 2 months. So within this time, an animal can appear healthy, but it can still be infected. And the clinical signs in animals include behavioral change, sudden behavioral change, aggression, also strong salivation around the mouth. But it can also go the other way around, where the animal is suddenly becomes very weak, it doesn't eat, it has seizures, and then it results in the death of the animal, which is maybe for some owners sudden or appears sudden. But once the animal starts showing the clinical signs in rabies, it 100% of the times results in the death of the animal.
Wow.
On the human side, it is the incubation period. So going back to that, so the time between when a person is bitten by a rabid animal and starts showing the symptoms of rabies, that can vary between 2 to 3 months. So like in the case of the patient from Okusi, but it can also vary between 1 week to up to a year. And this is dependent on a couple of factors, which is on one hand, the location of the bite. So let's say a person gets bitten by a rabid dog by the leg. It takes the virus a longer time to reach the central nervous system. But if a person gets bitten by a rabid dog by the neck or the upper part of the body or the face, which is unfortunately often the case with children, then it takes the virus a shorter amount of time to reach the central nervous system. And the incubation period is also dependent on the severity of the wound and also the load of the virus in itself. And going to the symptoms in humans, so as mentioned, in the beginning they're very similar with the symptoms you get when you have the flu, which is a headache, coughing, pain in the throat, and it can also, and it leads to having at the wound site the feeling and sensation of itching or burning sensation or pain, and then it progresses to anxiety and fear of water, fear of light, which I know they sound a bit crazy, but it's coming to that, confusion, paralysis, coma, and then eventually death. And I have to stress something very important. So globally, 40% of rabies deaths occur in children below 15 years old. And for Timor-Leste, this is a very important piece of information, and especially for parents here, because it is a high risk, as nearly 40% of the population in Timor-Leste is below 15 years. So you have a very young demographic. And in this regard, I also want to encourage the parents to encourage their children to be open about communicating to them if they get bitten by a dog or if they come in contact with an animal that showed unusual behavior, and encourage them to be open in communication so that the parents can take the necessary step to protect the life of their children.
How can our listeners support or get involved in the efforts to prevent rabies in Timor-Leste?
So the median age, which was a very interesting piece of information for me. The median age in Timor-Leste is 20.6 years, and it is one of the youngest populations in Southeast Asia. So Timor has one of the youngest population in Southeast Asia, and this means that young people have a key role to play in society in general. And we believe they have a key role to play in the rabies response. So in this regard, I want to encourage the youth of Timor-Leste to take the lead in spreading life-saving messages to their families, especially their parents or grandparents, who may not have access to social media or other digital information sources. And my message to the listeners is very simple. Talk to your family, talk to your friends, talk to your neighbors, and encourage them to take action against rabies. This means vaccinate your dogs because it protects them, it protects the family, and it protects the community. Wash your wound with water and soap for 15 minutes in case you get bitten by a dog or rabid animal, and seek medical treatment immediately at the nearest health clinic. And also report the bite and report any suspicious or aggressive dogs at the nearest animal health clinic. These simple actions can actually make the difference between life and death, and I believe that youth of Timor-Leste have the power to protect their loved ones, protect their communities. And to anyone watching this video, please share it on your social media platforms and help spread life-saving information.
Thank you very much for sharing the information with this rabies outbreak so far. And to all those who are listening in this podcast, Timor may be a small country, but situations like this need to be spoken. And ba ema Timoran tinebe atena kata rabies sa Timor iha, favorita spread, no parte te sira nebe ke iha aksaw ko na rabies niyan. And thank you very much for we were able to have Rebeca Sabou in this podcast to be able to share this urgent case of rabies in Timor-Leste.
Thank you for watching this episode. Special thanks to the great Bookshop for offering us the place. It is in Bemori and it has such great books for you guys to read. Thank you Timor Ads for helping us with productions.